I'm Radhiyatri and you're watching TimesXP. In Florida, a wave of fear has swept through immigrant communities after a new 2023 law left many hesitant just to seek medical care. One woman in Orlando, suffering from severe abdominal pain, avoided going to the hospital for 3 days straight. The reason? Well, she feared being asked about her immigration status. Now, this law is part of Governor's broader immigration policy, has made undocumented immigrants anxious, and also they are unsure about what might happen if they seek medical help. Now, on the other hand, the clinic she contacted reassured her multiple times, explaining that patients weren't required to answer the immigration status question. They made it very clear that the care wouldn't be denied and personal information wouldn't be shared with the authorities. Yet, her fear persisted. After days of suffering, she finally went to the emergency room. Now here, let me tell you, Florida isn't alone in this. Now, Texas is set to introduce a similar law on November 1st, 2024, affecting hospitals under state health programs like Medicaid and CHIP. Governor Greg Abbott supports the law, arguing that Texas shouldn't bear the financial burden of providing medical care for undocumented immigrants. But unlike Florida, Texas law doesn't require hospitals to inform patients that their status wouldn't be shared with the law enforcement, creating even more fear. Now, both states have large immigrant population, including those seeking asylum and people without legal status. Despite the high number of uninsured people in Texas and Florida, studies show that undocumented immigrants use less health care overall. Yet, these new laws are creating bigger barriers to the health care, with many choosing to endure pain rather than seeking help. Well, advocates and healthcare workers have been working really hard to spread awareness just about the laws that are limited. Now, clinics in Florida posted signs and held outreach sessions just to explain the patients that they can refuse to answer the status question and still receive the care. But fears remains high. Some patients has even left Florida to avoid legal and healthcare challenges. Now, in one case, a young woman worried about being separated from her child if she gave birth at the hospital. After much reassurance from all the advocacy, she finally went to the hospital, but the fear that she experienced left a lasting impact. Now, initial data from Florida's policy has its flaws. Reports suggest that nearly 8% of hospital patients and 7% of emergency room visitors choose not to answer the immigration status question. Less than 1% admitted to being in the United States illegally. Moreover, the state reported that unpaid medical bills have been decreasing and there is no clear link between undocumented immigrants and uncompensated care. Moreover, undocumented immigrants can't enroll in Medicaid except during the emergency, which means that many skip routine health care. Now, this leads to more severe and costly medical problems down in the line. In Cameron County, Texas, where 22% of population is uninsured. Now, Dr. James warned that skipping preventive care makes treating illness like cancer much more difficult and expensive later on. Advocacy groups in Texas are advising people not to answer the immigration status question at the hospital. Meanwhile, Florida's initial panic is fading. But questions remain the same. What is the real purpose of these laws? For many, the law feels really demeaning, specifically for the people who are trying to live and work in the community. As the political fight over immigration countries in Florida and Texas, undocumented immigrants are left trapped between fear and the need for the healthcare. Do let us know in the comment section below what is your opinion on this. For more such videos, do follow TimesXP.